Hi, class. It's me again. I know we've talked about how cancer can form, how the cancer cells they multiply very fast, the different kinds of cancers that patients can have. We're now going to be talking about the treatment options, and one of these options is through the use of chemotherapy. The objectives are to state 3 reasons why chemotherapy would be administered, define chemotherapy terms such as adjuvant, neoadjuvant, induction, consolidation, maintenance, first-line chemotherapy, second-line chemotherapy, and palliative chemo. Also to explain how chemotherapy works on cells and to list 3 chemotherapy types. So what is chemotherapy used for? To cure cancer, control tumor growth, shrink tumors prior to surgery or radiation, relieve symptoms such as palliative care, and destroy microscopic cancer cells. So I put a little diagram there for you. You can see the cancer cells. So there's different ways that chemotherapy can destroy that, and that's by preventing blood vessel growth, stop cell division, cause spontaneous cell death, or creates a non-dividing cell by altering cell structure. So we're going to go into different types of chemo too, but prior to that, we're going to go over some chemotherapy terms. You may have heard the word adjuvant, and this is used to destroy leftover cancer cells. So for instance, if a patient had breast cancer and had a mastectomy, the providers may be worried that there's still some cancer cells floating around. So they're going to use chemotherapy to get rid of anything that's left over. Neoadjuvant is administered prior to surgery. This helps shrink the tumor. So for instance, if you had a patient that had a big tumor size in their breast, and you want to shrink that before they do the surgery, that way you're doing less invasive surgery on the patient. Induction chemotherapy is to induce a remission. Consolidation is administered once remission is achieved. So the patient's in remission, but they want to continue remission. They don't want anything coming back. Maintenance is to help prolong remission. This is usually for ALL, AML, APML. They'll continue this for years. I had a patient that has ALL, and I saw him a couple months ago, and he's been receiving the same chemotherapy for probably 5 years now, and it's working for him. So chemotherapy terms, we have the first line. This is considered the standard of care. This is what the evidence-based practice shows us that works for this type of cancer. The second line is if a patient does go into remission. This is, if the patient relapses, they're going to use the second line treatment to hopefully knock that out again. And then there's palliative, and this is administered for symptom management. For example, if a patient has a tumor that's pressing on their lung and it's hard for them to breathe, they may give them chemotherapy just to help shrink that so they have an easier time of breathing. So how does chemotherapy work on the cell? Well, it targets the cell in different phases of the cell cycle to allow for cell death and or damage. There's a combination of different chemotherapies are needed at times to fully kill the cancer cell because they do work in different ways. Unfortunately, with chemotherapy, all cells are compromised. It's just not the cancer cell, it's all cells. So with that, the patients can become immunocompromised. Basically, their white cells are deplenished, and this can cause them to be neutropenic, which puts them at higher risk for infection. Their red cells can also start lowering, which would cause shortness of breath, heart palpitations. They may need blood transfusions to be able to continue chemotherapy. And also their platelets may drop. And platelets are the cells that help stop bleeding. So for instance, we'll recommend to patients using a soft toothbrush when brushing their teeth. And we try to tell them not to use, regular razors because we want to avoid any form of cutting that can happen. So these are the different types of agents. We have alkylating agents. This chemotherapy keeps the cell from reproducing by damaging the DNA. This is to treat lung, breast, and ovarian cancer, as well as leukemia and lymphoma, Hodgkin disease, multiple myeloma, and sarcoma. In rare cases, this type of chemotherapy can lead to leukemia due to the effects on the bone marrow. So unfortunately, with this chemotherapy, it destroys the marrow and puts the patient at higher risk to developing leukemia. It is rare, but it can happen. Nitrocereus, this is another form of chemotherapy. This is able to go to the brain. This goes through the brain barrier, so they're used for certain types of brain tumors. Antimetabolics. This is to stop the DNA from copying itself. It acts as a substitute for the building of the cells by blocking the RNA and DNA. This prevents a cell from reproducing. These are used to treat leukemias, breast cancer, ovarian cancer, intestinal tract, and other cancers. Anti-tumor antibiotics, anthracyclines, they change the DNA inside the cancer cells to keep from growing. They bind with the DNA so they cannot copy itself and the cell cannot reproduce. These are used for several cancers. You need to use caution though with this type of chemotherapy because it can affect the heart. All these patients will get an echo prior to receiving chemotherapy. And if there's any issues, they'll recheck that. And another thing is this chemo is monitored because you cannot give, there's only a certain limit that you can give on this. So the providers really have to keep a close eye on this. This is called topoisomerase inhibitors. I'm not good at pronouncing that, as you can see. I'll just call it topo to abbreviate it for you all. This is a plant alkaloid. They interfere with enzymes, the topo. They separate the strands of DNA so they cannot be copied. There are different types of this. There's a 1 and a 2. We also have meiotic inhibitors, the plant alkaloids. It stops the cells from dividing into new cells. These can cause nerve damage though, and I'm going to go into that a little bit with you, but there are 2 kinds. There's taxanes and vinca alkaloids. This chemotherapy, it works great. However, it can cause what's called peripheral neuropathy. It affects, as it says there's nerve damage, which can cause numbness, tingling, or pain in the hands or the feet. It also can affect their cold. Like if they're outside in the cold, they'd be freezing. Their hands feel like ice. So we recommend wearing gloves, socks. We also have to do a lot of education with the patients to prevent any harm to them because they may not realize the temperature of water. Floor rugs we try to avoid so they don't fall. Another thing that's important for the provider is to see how much damage has already been done. If there's too much damage, we'd either have to stop the treatment or we'd have to dose reduce. Then we have the corticosteroids. These are natural hormone. And the examples are prednisone, methylprednisolone, and decadron. These are used to help minimize the cancer cells. However, they're also used a lot for anti-nausea medications. And the reference I used was American Cancer Society. This is a great reference I recommend for all of you guys to take a look at. It's a great resource. So please, if you have time, take a look at that. Thank you.